Okay, here we are. We're back. Welcome to the Melillo Method Podcast, Everything Brain. I'm Dr. Robert Melillo. This is my partner here in everything, Dr. Peter Scire. And we're going to, we're really interested in touching on some topics, again, that we've talked about, but really getting into much greater depth and detail this time, right? So.
Yeah, great to be back. Great to be back in the city, and it's like hot as heck, man. What's going on here?
Yeah, the weather's been amazing.
And your Yankees lost. I mean, come on.
Yankees, Mets.
And the Mets.
All right, but at least they were in it. So.
And the Braves didn't get past the first round. So.
Yeah. All right, so let's get into it.
Yeah. So I thought today we'd really delve into, one of the main points of your model has always been this idea of bottom-up interference that happens in the brain, okay? That we see all these different dysfunctions in these variety of children disorders. They may have executive disorders, they may have emotional dysregulation, or they may have these deficiencies in cognitive or social development. And the rest of the world is always trying to deal with that from a behavioral model or an academic cognitive reinforcement or even medication. But you've always been saying that, hey, before that can ever be achieved, you have to take away the blocks that are in the brain at the bottom four, that brainstem cerebellum mechanism.
Right.
So why don't you discuss how that came about and what you've been really looking at for the last 20 or so years?
Yeah, it's really an important point. I'm really glad we're talking about this today because there's, when you read books or literature, or even from some of the best people, even the people we know, they know how the brain works. They know different systems of the brain. They may know it from a psychological perspective. They may know it from an educational perspective or behavioral aspect. But, they're not looking at it in the same way that we are because they're looking at it like, we'll use attachment as an example. Attachment is something that's been studied a lot. And, people like Dan Siegel and Alan Shore and Casalino really talk about that stuff and do a really good job. And the idea is that we know that it happens primarily in the right brain. We know that the right brain is responsible for social development, social networks, emotional regulation, nonverbal communication. And we know that a lot of that, in the growth of it, is influenced by the interaction with the parents, especially the mother or the earliest caregiver, and their interaction. And we've talked a little bit about right brain to right brain communication, that the mother or the caregivers, right brain feeds the child's left brain, and that in doing that, it helps build the right brain, and it builds that attachment and that social awareness and that, being able to read emotions and all of that. And so most of the literature, if that's not happening, if someone has an attachment disorder or they're not really building those networks in their brain appropriately, the thought is, well, they're not getting the stimulus. That stimulus from the parent or the caregiver is not there, and therefore they're not developing it in the brain. So they have an attachment disorder because basically the parent or the caregiver didn't do the right thing. And, we've disagreed with that. We see many parents and many kids that might qualify as attachment disorders or don't have the development of that social network in the brain. And it's not because the parents weren't doing the right thing or giving the right signals or all of that. It's because what also has to happen is the brain has to grow at a certain maturational trajectory. And if that trajectory is slow, then even though the signals might be there, so let's say a 6-month-old child should normally receive these signals from the parents, which builds this area of the brain, and then it goes from there. If that child's brain isn't at a 6-month level, it's at a 2-month level, even though they've been born 6 months ago, but there's a physical developmental slowing or delay in the brain, then those signals may be there, but the brain may not receive it. And that's what we talk about, top-down signals, kind of like that. So what we want to talk about is really how the brain actually grows, like growing anything or building anything. I always use the analogy of a building, but it starts from the bottom up, from the lower part of the brainstem, and then it goes in certain sequences up and then builds the brain and activates the brain so that it grows properly. And then the brain is designed to come down and regulate it, and bottom up and top down working together is the system, and that's how it's supposed to work. So, that's where understanding what modalities you use, what therapies you use, where is the problem? Is it something that's purely a mental problem or a cognitive problem, or they didn't learn something, or the signals weren't there at a certain point, or is it a developmental issue where that part of the brain literally hasn't grown yet? And then, it takes a very different approach.
Yeah, and when you're talking about that lower brainstem, you're really talking about that medullary, pontine structure, and one of the primary areas that are primary inputs into that medullary system being the vestibular system. And so I think when we're doing our infant exam, one of the early things that we're looking at is vestibular ocular reflex, where we rotate the head and see if there's an eye movement in the opposite direction of the head movement in an up and down, like you're moving your head right now, or going in a yes manner or a no manner. And here we are, assessing these young children, and we don't see that appropriate vestibular reflex. And as we've talked in prior podcasts about these vestibular primitive reflexes that are tied to this system. So the fact that they have a retained asymmetrical tonic neck reflex, or symmetrical tonic neck reflex, or a tonic labyrinth reflex, or they may not even necessarily seeing them appear right away. Developmentally, that there's that, like you said, there's that instantaneously developmental delay that's happening from the moment of birth, that's now just literally holding up every succession of function.
Right. Yeah, and that's the point. There are these, systems during physical movement and development. That movement is what initiates all brain growth. And movement initiates the engagement with the senses around us. We start to feel our body as they move. We're contracting our muscles. We're, looking at colors and lights and sounds. And right from the beginning, a baby is attracted and going to be looking at where sound is coming from or where visual input is coming from. So, but they move to maximize it, right? If we hear a sound, we, lift our head up so that we can hear that sound better, or turn our ear, or we look towards something. So movement initiates the sensory exploration, and then that gets the sensory input, and that builds the brain, literally building the brain from the bottom up, right? So like, a plant growing out of the ground with roots, or I use the analogy of like building a building. We have the foundation of the brain is in the lower part of the brainstem called the medulla oblongata. And the medulla is on line first when we're born. That's most active. The whole brain is active and growing, but what's most active and what's more developed at that point is the lowest part of the brainstem. And this is where most of the primitive reflexes come from. Also, you said the pons, which is the area of the brainstem above that, and that has some of it. And in those areas, there's other things happening, right? So in the medulla, the things to keep a baby alive right off the bat, like to be able to keep their heart beating.
Our autonomic centers.
Their autonomic center, their vital centers,
vital
right?
centers,
that have vital, so that they have appropriate pulse rate and breathing and blood pressure, and they can do basic digestive functions. They can regulate, hot and cold, and so the basic.
And at that
functions,
moment, these infants are sympathetic dominant.
Right. So when they're born. When we're born, our sympathetic nervous system, our fight or flight nervous system, is really more on high alert. And there's a nuclei in the medulla called the rostroventral lateral medullary medulla nuclei that is the one that is the primary nuclei for that sympathetic fight or flight system. And that's on high alert. And there are other nuclei that are there but are not really fully mature. And they will mature over the course of that first year and beyond. as the brain grows. But if the brain isn't growing, then they may not mature. So we're born with a basic default system basically in our brain that's online. So a really simple basic operating system that makes sure that we stay alive.
Yeah, survival, yeah.
And it's allowing us to move. And those are the primitive reflexes at a very basic, simplistic level. And then that, if we're growing properly and moving properly and activating the brain, and the brain is maturing, over the course of that first year, the reflexes should gradually go away, and the brain, and that area of the brain should mature fully. And then another nuclei called the nucleus ambiguus, the what we look at as the parasympathetic or vagal nucleus should come online, and then the vestibular nuclei should come more online, and higher centers of breathing, and brain matures, and then we go to the next level and we go up from there.
And as that brain is maturing, what we're seeing is that we're seeing the sympathetic system actually begin to slow down and the parasympathetic system to become more dominant.
Right.
However, when we're looking at these cortical immaturities, what we're seeing is not that. We're actually seeing these children stay more sympathetic dominant.
Right.
And it's of your belief that that's where we're seeing where we get a lot of this digestive immaturity that we see, and we see, traditional leaky gut, or the fact that the gut itself is not actually closing, that we're actually seeing this imbalance in the immune response, and looking at maybe a more slant towards a pro-inflammatory immune response, because the one thing we do know about the vagal through Kevin Tracy's work is that the anti-inflammatory loop that occurs.
Mm-hmm. Yeah, so let's get into this and talk a little bit more about, the references for this, right? So when we talk about, what's happening in that parasympathetic, sympathetic, vagal, sympathetic, we know that the guy that really has written more, probably better than anything else, is Stephen Porges, right? So Stephen Porges developed the polyvagal theory many, many years ago. And it really started where he was really interested in looking at the autonomic system, and he's working with neonatal babies. And he noted that there was a lot of babies that died of sudden infantile death. And when they died, it seemed to be related to that their blood pressure suddenly dropped. And, he noted that, okay, that's when the blood pressure goes down, that's a parasympathetic mediated response. But everything we know about the autonomic system is that they should be more in a sympathetically dominant state right now, at least from 28 weeks on. And so why would their blood pressure suddenly drop out? He didn't understand that. It didn't make sense, but babies were dying from it. So he really dove into the research and went into looking at it from an evolutionary perspective, a lot of the same things I did in the beginning. And he discovered that there was an older parasympathetic system that he referred to as the dorsal unmyelinated vagal system that was in the back of the lower part of the medulla, or the brainstem, or the dorsal part of it. And that was related to a nuclei called the dorsal motor nucleus. And that this was related to the freeze response that we see in animals, and that still is around when people are really scared or nervous or whatever, and that was the first vagal system and parasympathetic, and that came on first before the sympathetic. Then the sympathetic nervous system came online later in the womb, and ultimately that was the dominant system when we're born. And then over the course of the first year, a newer ventral myelinated parasympathetic nuclei called the nucleus ambiguus should develop, and that should shut down the sympathetic and reduce the freeze response and control both of those things. So, it was more than just sympathetic and parasympathetic. That's why he called it the polyvagal. There's two different vagal systems. And one was older and one was very new, and the sympathetic was right in the beginning. And all of this is happening in the medulla and should happen and really develop over the first year. And again, that's all driven by, that maturity of that area is driven by movement.
And so when the movement doesn't occur, or the inappropriate, or let's say better yet, say the sensory driving coming in from, let's say, the proprioceptive system and the vestibular system that allows for that myelination to occur and to build some of now these inhibitory pathways coming down, what we see is just that constant expressiveness of the sympathetic dominance. And, so again, we can see these children that have, very, retained, like a Moreau response, a reflex that's been associated with sympathetic dominance, or we see that these children have a lot of digestive problems, or, again, that they, seem to, maybe startle easy, or they maybe have some light and sound sensitivity because of the fact that their midbrain is very dominant.
Yeah, so when a baby is born, again, we said their sympathetic nervous system is on. And so the sympathetic nervous system, what does it do to the baby, right? One is their heart rate is very fast. We know an infant has like a pulse rate of like 140, where normal for a normal adult would be between 60 and 90. So their heart rate's real fast, and their breathing is very kind of rapid and shallow. But also how it affects their nervous system or their gut and their digestive system is that when the sympathetic nervous system is on, it's designed because of fight or flight to take away blood from the gut and from from many of the organs and move it to the muscles and the head to fight or run away. And so when we're born, the baby doesn't have a lot of blood flow into the gut, and the gut really isn't doing much. They're supposed to be getting breast milk or formula, but really breast milk. And so that's pretty much pre-digested. You don't have to produce enzymes or acid to really break that stuff down. It just kind of filters through the gut. And you don't need a lot of blood flow for absorbing that because, again, it's just a liquid. It comes in and it just flows. Also, the baby, as you know, is not producing their own antibodies. So their adaptive immune system hasn't fully developed. They don't really have the Th2 system. They're not really producing antibodies. So they get the antibodies through the mother's breast milk. And those are large protein immunoglobulins that wouldn't get through a typical mature, closed up, tight junction stomach lining. So we're all born with a leaky gut. Most people don't realize that, right? They say, oh, I have a leaky gut. I just was talking to parents. And, again, like most people, they were told, your child's problem started in the gut, and it starts with a leaky gut. And, or the leaky gut developed because they were eating gluten or because of, because of inflammation in their gut. And all of that is mostly not correct. Doesn't start in the gut. It starts with the regulation of the gut. The gut starts open. The gut starts not producing a lot of acid and enzymes, and doesn't have the right mix of bacteria quite yet. I mean, it gets most of it as it goes through the birth canal. But again, if we have a C-section and we don't do a birth canal, we don't get that. But as the brainstem matures, that nucleus ambiguous, the parasympathetic nervous system should develop, and the gut starts to close up. We start to form these things called tight junctions that make it really difficult for anything large to pass through. We produce acid and enzymes. So as a baby starts eating solid food, what comes on that solid food quite often is bacteria and yeast and fungus or parasites. So the acid should kill that. The acid breaks down along with the enzymes so that we can break it down to very small molecules called amino acids, and then they can filter through, and then the blood flow increases, so now we can absorb nutrients and vitamins and everything from the food that we break down, and that's the way it should happen. And all of this should pretty much be fully online at 1 year when the brain has come top down and is now regulating the brainstem in the best way. So, all of that is very important, and, it all is led first and foremost by movement and by these primitive reflexes.
Yeah, and that top-down formation that you're talking about is really these descending proprioceptive spinal pathways that are now really becoming strongly myelinated around that 12 to 15 month of life when the child is going upright and going into a bipedalistic aspect.
Right.
They've moved from those primitive reflexes that led to those advanced postural reflexes. The postural reflexes are now allowing for the higher drive of the proprioceptive and vestibular aspects, and then obviously we're getting more volitional control of our eye movements, because early on we have more reflexive eye movements. We have more of purely the optokinetic response. That's a reflexive response. But as that brain begins to start maturing, and now we start getting more purposeful movements of our eyes. So as those descending pathways are growing, they start firing down, they start inhibiting all those primitive reflexes. And like you said, they're now also firing down and starting to have more modulation on the sympathetic nervous system. Because it's not that we're saying that we don't need the sympathetic nervous system. We're saying we need it.
Right, we do need it.
But we need it to be in a modulated way.
Right.
Okay. Yeah.
Right. And, so a lot of parents will say to me, well, how do I know? Like, when is this? How do I know when things are not going properly? And there's a number of things. But the way I look at it is these primitive reflexes, again, and we've talked about this before, but they're there because the brain, especially in humans, is very immature. Humans have the largest brain per body size of any primate, but we also have the smallest birth canal because of being bipedal. So with that, we have to keep the brain very restricted before it grows, more than any other animal. And also, different of other brains and other animals, we have to then be able to know when to grow, meaning when we're outside the womb. And now we have genes that are more sensitive to environmental input, so that we know, okay, we're being bombarded by light and sound and temperature and movement and gravity. That means grow the brain, because now we have to go from 20% to 90% in 3 years to get the brain to grow properly. So there's this massive growth that has to happen. It's stimulated once we're outside the womb. I mean, the brain is growing before it, but it's got to be restricted somewhat. And then it is initiated by movement. But humans are also the only animals that can't just get up and walk and run, right? So we won't walk for a year. And so how do we move when the part of our brain that really controls movement isn't really developed yet? So we have these movements in the brainstem. And the first sign of that for me is, a baby is supposed to get themselves in a position to be born, right? Mm-hmm. They're supposed to turn upside down and turn backwards and to the right. How do they know how to do that, right? How does a baby know that they're supposed to get into that position? It's because there's already these automated pre-programmed reflexes that are already being active in the womb. Now, if a baby is breech, if a baby doesn't get into the right position, or again, they should do it without the cord getting wrapped around their neck. If the cord gets around their neck, it means they're not moving in the right way. So all of those things kind of are an early signal to me, okay, these programmed reflexes aren't really working the way they should. And then they should come through the birth canal and use those reflexes to get themselves through the birth canal. If they don't come through the birth canal because they have a C-section, then they're not using those reflexes. But if they can't get through, I just had a mom, this week I was talking to them, and she was saying how everything seemed all right. The child was being born, and the head was poking out, and the baby was coming out, and then the baby got really literally sucked back in. And they had to use vacuum extraction to get the baby out. Now, why would that happen? Well, at that point, the baby should be helping. Mm-hmm. The baby should be using the spinal gallant to push themselves through. They should be using the tonic labyrinthine to shoot themselves out. But if they're not, then, the mom's pushing only gets them so far, and then they need to help. And if they don't help, they got sucked back in, right? That's another sign. And then for me, I told you, one of the first signs is, can they latch on and feed on a breast? If a mom chooses to breastfeed and the baby can't do that. So there's already some altered muscle tone. And then these reflexes are there to lead them through these stages of development, to roll over to both sides and then crawl on their belly in a commando crawl and then get on all fours and rock back and forth. And then that inhibits the tonic labyrinthine and partly the asymmetric. And then the symmetric comes out, and then they should be sitting up, they should be pulling up, standing up, all of those things. And then really at 12 months, they should walk, they should talk, they should be pointing, they should have eye contact. Mm-hmm. And that's how it should proceed. And the reflexes guide them towards that. And during that time, what you're seeing is the bottom-up development, and then you're seeing the top-down as those reflexes go away. And the reflexes at 1 year should be gone. And the last one is on the bottom of the foot. It's called the Babinski. And as soon as we start to step on our feet, we talked about this, that should go away, and we should be pushing down. And that's the last reflex to go away, and that should happen again right at 1. And then now we go on to the next step. So it's like building a building. We start with the bottom, with the foundation, with the medulla, and then once the reflexes are gone and the parasympathetic and nucleus ambiguus is on, and it's inhibiting the sympathetic, and now the bottom of the foundation is built, the vestibular nuclei are fully active, and now it's solid. And now anything on top of it will be solid, and we go in stages. If the reflexes are still there, that bottom is not fully solid, that parasympathetic nervous system hasn't developed, and anything on top of it is going to be, not fully mature and not solid. And, it's just the basics of building anything.
Yeah. And I think the point here that's really important for me, especially when we're working with children that even at 12 months, 15 months are unable to walk, is really that relationship of the vestibular system. Because one of the things I think is missed in the community at large is the relationship of the vestibular system on spinal posture, okay, as well as ocular motor function. Okay, that many times you see these parents that say, well, I want to put them in a vest to get them to sit upright. I want them to be in these gravity suits and everything, and you're trying to force them into these postural positions. Well, number one, they don't have the tonality in these extensor muscles that we've talked about. They don't have the tonality in their lower paraspinal muscles, their glute muscles, these muscles of extension, and even the cervical neck muscles that there. And so oftentimes we do see the asymmetrical tonic neck reflex, the symmetrical tonic neck reflex, the tonic labyrinth reflex. But one of the hallmarks that we also see is the literal underdevelopment of this vestibular system. Mm-hmm. We can do the doll's eye that we're talking about, the VOR testing in all planes of vestibular mechanisms, and then we put them in a rotating chair and we rotate them and we look for that post-rotational nystagmus, and there's no nystagmus there.
Right.
But yet everybody thinks that these kids are going to walk because we stuck them in some gravity suit, okay, and we're trying to artificially push them into, So you might be able to get those proprioceptive muscles to begin to fire, but okay, you take it away and there's no input coming in from the vestibular system, so what do? They just slump right back over.
Yeah. And that's, really important point, because, when we talk about being bipedal, we know that my first book was all about, evolution and evolution of the brain, and I spent a lot of time on this. This is an area that I was fascinated in from a long time. We know that being human and having big brains and being a hominid is related to being bipedal. Those two things, right, are together. So, being bipedal and having a big brain, those are absolutely related, and speech and all the things that go along with it. So how does that actually work? When we look at other primates like chimpanzees or great apes, they're not bipedal. They walk on their knuckles and they're knuckle walking, and it's very different. Their body's pretty similar, but the distribution is very different. And really the only main difference is the way that their brain and their nervous system is controlling. Like, to be able to get up in a bipedal position, what changed? Well, what changed was our brain. What changed was our cerebellum. What changed was the way that we controlled our postural muscles and the balance of muscles. so that going from a quadruped position, if you look at most primates, mammals, this anterior compartment here, like the bicep is bigger than the tricep. The glutes and the hamstrings are bigger than the quadriceps and the psoas or the hip flexors. The pecs are bigger than the rhomboids in the back. So we have this natural, these muscles are naturally bigger because for most of the time, quadruped animals use those muscles to be on all fours. Those are muscles that are more advantageous when you're on all fours. Mm-hmm. But to stand up, you need to be able to use the front of your legs and, stand up with your quadriceps. You need to be able to get your arms to open up. You need your chest to open up. You need your spinal postural muscles to be stronger and to lift your head up, right? And so, but the muscles that oppose that are naturally bigger. Mm-hmm. So how do we get the muscles that are actually smaller to actually be stronger? And the way is because the brain gives more emphasis to it. The brain is literally what, as we come down, which creates that balance between the muscles to allow us to be in this bipedal state. And that's all happening in that first year. And we see it. It's like mini evolution. And as you said, the vestibulospinal pathways.
Yeah, the reticular spinal tract system.
The reticular spinal tract in the brainstem. And then ultimately, again, the brain comes down. Yep. And the frontal lobe especially, and it actually dictates the balance of those things.
Yeah, so I mean, for me, it's always tough when you're working with a family and they're getting information from a variety of practitioners, and but they don't understand the neurology. Right. They don't understand developmental neurology, and recently I had a family that told me like, oh, I was told that you don't want to spin a child. You don't want to produce nystagmus. I'm like, well, number one, if they don't have nystagmus, yes, you do want to produce nystagmus. Right. That shows you how hypodelayed their brain is. And so, when we're assessing these children, we're putting them in a spin chair, we're rotating them in a very specific direction and the amount of rotations that we're doing. And then we're looking for these fast, rapid eye movements called nystagmus. And there's been normative data that goes back, 40, 50 years on what that amount of nystagmus should be at. Sure. And so, when we don't see it, that's a huge concern about the development. And our experience has taught us is that usually when we see that, we obviously see the retained primitive reflex that have to do with the maturation of the vestibular system. And it also correlates back to the immaturity that we see in postural tone, because as you've talked about over the years, is that the primary sensory system is going to be that proprioceptive system. And so all the other systems, the vestibular system, the ocular motor system, visual processing, auditory processing, is all built upon that proprioceptive system because of the presence of gravity. Yeah.
I've never really seen anybody, to be honest, even though we've read obviously some of the best books and papers in the world by people like Lee and Z and other people like that about the vestibular system. I've never seen anybody really explain why, when you spin a child in some cases or an adult and they don't get dizzy at all. Mm-hmm. Like we have some kids, we can spin them 100 times. Yeah. There's a lot of research out there talking about if there's actual damage, right? If there's a physical damage to the inner ear or physical change, or there's a cyst or something, or increased pressure like in an ear infection. Or if they talk about central issues, which they usually mean there's like a stroke or there's a tumor or there's, again, some sort of anatomical structural issue.
Some vascular event or some space-occupying lesion,
But I've never seen anybody really take it on from a developmental perspective and say, well, we have a population of kids that you can spin them and they don't get dizzy at all. Why?
Yeah, we've seen thousands of cases like that over the years.
But no one's ever really explained that, but we have, and I think the best way is that it's because there's nothing wrong with the inner ear. Those signals are coming in, but they're not registering, because where do they get registered? First of all, in the brainstem, and in the nuclei that aren't mature. How do we know they're not mature? Because the primitive reflexes are still there, right? And because they're sympathetically dominant, their pulse rate's still high, their gut isn't working, all of those things are there. Their pupils may be larger, they have the Moreau reflex, right? So we know that hasn't grown.
Yeah, I mean, that's a great point, because recently I had a parent tell me the other day, it's like when they knew like when their child is getting ready to go into attack mode, they go in that, and he said pupils. I'm like, the pupils dilate. They're like, oh yeah, these pupils just get ginormous.
Right.
And then all of a sudden it is full on attack mode.
Yeah, I just had parents, before we got here, they were talking about how their son is so hypersensitive to sound and light. Yeah. So why is that? And he has a tremendous Moreau startle response. So in the sympathetic fight or flight, as we said, one of the things it's going to do is take all the blood from our gut and move it to our arms and our head. But also, if you're in danger, what are you going to do? We know that when we're scared, if you're scared at night or you're watching a scary movie, all of a sudden every sound is amplified, right? Yeah. You're like, and then what happens is your pupils get bigger because you're like, you want to see everything. So you become more intensely focused on looking for danger. Yeah. And so therefore you also hunch over a little bit to protect your chest. So again, you go away from that bipedal position. You kind of go down. And so we see that there's this response, which is the sympathetic nervous system activating, and it's the opposite of the parasympathetic. If you're in that all the time, then we know that your gut isn't working, that you have most of your blood coming out of your guts going into your arms or your head, and that your pupils are going to be larger. What we often see, though, is asymmetry of the pupil, where one side is larger than the other. And this has been noted in autism. And we know that the larger pupil is usually on the side of the more immature, underdeveloped brain that is more in a sympathetic state.
Yeah, and you're referring to there is the idea that the sympathetics we have a bilateral system of sympathetic aspect. And what we should see is as the brain matures, the hemispheres through other pathways are modulating the single side. The right brain is trying to modulate the right sympathetics. The left side is trying to modulate the left sympathetics.
Yes.
But when we see this brain in maturity, what happens is that the side that's weaker tends to allow the sympathetic system on that side to escape, to actually fire too rapidly. And I think one of the other things that we haven't touched on is the idea that when we're sympathetic dominant, we also reduce our respiratory rate.
Right.
Okay. And that's why when we decide to put a pulse oximeter on these children, we tend to see maybe some lower pulse rates or fusion indices and
lower oxygen,
oxygen saturations and stuff. Yeah.
Right.
Yeah.
And that was a good point. So that when you build bottom up, we're coming up this way. Some of the pathways are crossing over. Some are coming straight up. Almost all sensory pathways cross over from one side of the body to the other side of the brain. But then that side of the brain comes down and it crosses back over in some things, but also comes straight down in others. And when we're talking about autonomic regulation, inhibiting the primitive reflexes, affecting, immune regulation, it's really the same side.
Yeah.
And even looking at muscle tone, it's the same side. So, looking at things like facial asymmetry, a pupil that's larger on one side, corner of the mouth that droops down, or, looking at different angulations of the arm, looking at blood pressure being higher on one side versus the other. As you just mentioned, having less oxygen on one side, maybe sweating more under one arm than the other. These are signs that there's an asymmetry in the way that the brain and the nervous system is regulating the autonomic system. And if it's there, then we also know that, the gut isn't working properly. And it's not because there's a primary problem in the gut. It's because the gut didn't mature because the brain isn't giving the right signals to that parasympathetic nervous system.
Yeah, so I think that's a great point to where, most parents, get the idea that, hey, my right side of my brain controls the left output.
Yes.
But the idea that we have almost 10% or more pathways that are firing down ipsilaterally and controlling these particular functions. And again, these autonomic aspects, as we're looking and studying these immune aspects. And so, yeah. So A couple good things. I think that, again, you've done a great job in the books over the years, in both the Disconnected Kids book and both chapters or editions, and then also your autism book, where you really, took parents through to be able to do that postural evaluation and be able to see those differences in postural head positions and arm angulations and muscle tone on one side of the body versus the other side to be able to look at for that imbalance. And so, again, taking them through and saying, hey, we're first going to identify these primitive reflexes. And I think, 8 or 9 primary reflexes now that you really have said that these are the ones that you think are the most important ones to look at. And then, you move into that postural assessment. Because, for example, the other day I had a 11-year-old boy with autism in my office. And again, he had this head tilt, opposite head rotation. And then, if anything, he had this really predominant head flexion.
Right.
He was constantly in head flexion.
Yeah.
And it was fascinating because as soon as I did some vestibular assessment on him, he just wanted to go back. Like
Right.
his paw, as soon as we closed his eyes, he just wanted to fall backwards.
Yeah.
So looking at how his angulation of his head was changing to compensate for the loss of input from that postural vestibular system,
Yes.
or the posterior vestibular system. Yeah.
Yeah, and the idea of looking at that, like I said, is one way of looking at it. But the point is that all of our cognitive abilities, all of our higher cognitive functions, executive functions. People are really concerned in ADHD and other things that dysexecutive syndrome, or we need to get executive function, and we need to train them on executive functions. We need to train their attention or their concentration or their focus. All of those things are emergent properties, which means they emerge out of the brain as it grows and develops. If the brain doesn't grow and develop, it won't emerge. And just by doing those skills won't make the brain grow and develop. This is a really key critical point, because it's something that very few people understand it. And, in the psychology world, and even people that we know, like I said, people like Siegel and Shore and everything that know a lot about the brain and really know it really well, they're still not getting this idea of the actual physical growth and development. And even though they talk about bottom up and, vertical integration, bottom up, top down, they're really not looking at that as that relate. It's kind of a given. Okay, well, that just happens. That's going to happen. The brain is going to grow from the bottom up, and then it's going to come from the top down. And as we're doing that, we're going to get certain signals that are going to, change the brain and develop certain things in the right brain and the left brain. It's like, again, in pediatric neurology, it's a given that these primitive reflexes automatically are going to go away. And so they're not thinking of it like, but what if the brain isn't growing? What if that bottom up doesn't ever actually finish? What if those reflexes don't go away? They're not thinking about it from a physical growth standpoint. They're just saying, okay, well, this is the way the brain grows, and this is the way it's going to happen. But what if it doesn't? And so, therefore, when you're looking therapeutically at intervention, if you look at it and say, okay, well, a person doesn't have proper attachment because they were never given attachment, or they weren't given the signals from the parents. So now if we give them the signals, that will develop it in their brain and everything will be fixed. But it doesn't work that way. Why? Because it wasn't that the signals weren't there. It was what their brain wasn't growing, and they couldn't receive the signals. And their brain still hasn't grown properly, so they still can't receive. You can give them all the signals you want. It's like a child with dyslexia that can't read. We can make them read more. It doesn't work. We know that. We can make them read over and over, force them to try to read. It doesn't work. You have to, because reading is an emergent property that comes out as the brain grows and develops. So that's really a key point, because if you're doing these, what we call top-down modalities, where you're doing only things that work on cognitive skills, or try to teach a child to read or do math, or try to teach them behaviorally how to attend or to focus or concentrate, or you're just doing things that try to stimulate only the brain from the top, like doing neurofeedback or doing lasers or doing transcranial, and that's all you're doing, you're not really going to get the effect because the bottom still hasn't been built. The part of it to grow, if you don't have roots or the bottom of a plant, you can't just grow the flower, right? It just doesn't work that way. So this is, I think, a really key point that we understand, and it goes back to understanding evolution. It goes to understanding how the brain actually grows and develops, and how the emergent properties emerge and grow out of that. But they don't just come out of nowhere. And if literally the brain hasn't grown, you're not going to have these skills. And so trying to do only those skills. That's why we do bottom up. And then you can do top down at the same time, and it works pretty well. You don't have to just only do bottom up and then do top down. We can do both simultaneously, and so it happens even faster.
Well, it's been great today, and really intense conversation. And for our listeners out there, if you want to, again, get more of this and get more of the great information, the book. I mean, you've done a great job in the new version of the Disconnected Kids book now, where that chapter on why developmental milestones are so important. Chapter 13 is the new chapter that you really went into great depth about the emergence of these primitive reflexes, what they're designed to do, and then what happens when they're retained. Right. And then if the parents want to go further, they can go into going through the assessment process and learning how to do these key assessments. We talked about looking at these postural deviations that they're going to see that are going to allow them to determine a hemispheric imbalance, and then they can use their checklist to go through it. So I think that's the practical thing about these conversations, is that there are tools beyond just seeing you and I in one of our facilities, that they immediately can go out and get the book on Amazon and begin to really learn the foundation of your work, and then actually do an assessment on their child.
Yeah, so it's all in the book, and like you said, there are pictures, there are diagrams, and I see a lot of parents, obviously, and they want the best for their kids and adults, and people don't read too much anymore. Yeah. They usually come in and say, well, I heard you on a podcast, or I saw you on YouTube, or I saw your web series, and I get it, I understand. It's why we're doing this, right? Because you can listen to this podcast now and get the information. Yeah. But it really does help if you read. Yeah. And you don't have to read the whole book, even if you just read the first 5 chapters and then maybe chapter 13, so. But I think if you can read, it's all there. And it's really it's another way. It's a different way of learning. And you're going to understand it differently than just watching a podcast or listening to a podcast or anything like that. So resources are out there.
Absolutely. Well, it was great being here today, as always.
Yeah, great.
We're going to keep rocking and rolling.
Okay. All right. See you next time. Bye.